So here we're going to understand atrial fibrillation. And first and foremost, we need to understand that this is an arrhythmia. And in simple terms, an arrhythmia is when we have a heart rhythm that is abnormal. And there can be varying different abnormalities. Specifically here, we're going over atrial fibrillation, and the name gives it away itself. It's in regard to atria. Now, there is a typo over here. Atria is spelled like this. But the atria are essentially contracting in a manner that is not synchronous. They are contracting irregularly and rapidly due to these external signals coming in, resulting in a quivering or a fibrillating kind of rhythm in the atria. Now, this irregularity in the atria will also affect the rhythm of the ventricles. Now, first, let's quickly go over normal signal transduction in a normal heart rhythm. So we know that we have that SA node, the sinoatrial node, and it's known as the pacemaker of the heart. It sends off that initial electrical impulse, resulting in the atria to contract synchronously, pumping blood into the ventricles, and then that signal is transferred to the AV node. Now, when that AV node picks up the signal, remember that it has a longer refractory period, so it kind of delays the signal before it's passed on to the bundle of His, the bundle branches, and then the Purkinje fibers. After that brief delay at the AV node, the signal will travel fast through these three components, resulting in the ventricles to contract in a synchronous manner, pumping blood outward. Now, in atrial fibrillation, essentially what happens is that we have external signals coming in from the myocardium. Now, there's two ways in which we can have these abnormal signals. We can either have re-entry circuits in the atrial myocardium, which are going to cause impulses, electrical impulses to collide and cancel out. So then the AV node is going to pick up signals that are very irregular, causing the heart to contract in an irregular manner. Another way that we can have these irregular signals is through ectopic foci. Now, ectopic foci are essentially cells that are found in the myocardium that are excitable cells. They can act as pacemaker cells. And when these ectopic foci cells are excited and they send off electrical impulses, they send off randomized, rapid electrical impulses, which cancel out that SA node signal. So when we have these randomized rapid signals, these are going to be picked up by the AV node as well. And these randomized signals, they cause the atria to contract in a very rapid and irregular manner. And then once they reach the AV node, of course, there is that longer refractory period. So not all of those signals will go on to reach the ventricles. And we'll see how that is affected in the EKG and the heart rhythm in a second. But going over quickly again, atrial fibrillation, it is when the atria are contracting irregularly due to these external signals that are coming in that is not the SA node. So remember, the SA node, it's in normal heart rhythm, it sends the signal to contract the atria in a synchronous manner, and in atrial fibrillation, the atria are contracting in a non-synchronous manner. Now, if we look at the EKG, a normal EKG, the P wave, it denotes the atrial contraction, whereas the QRS complex, it denotes the ventricular contraction. And this is what it normally looks like. We can see that there is a distinct P wave, and if we look at it a longer version, we can see that the QRS complex, it's regularly spaced. But if we compare it to atrial fibrillation, we can see that it is irregularly spaced. Because remember, we have these rapid randomized signals coming in. Eventually, they reach the AV node. There is that delay period before it reaches the ventricle, and it causes the ventricle to also contract in an irregular manner, causing these irregularly spaced QRS complexes. So in atrial fibrillation, the atrial rate increases to 400 to 600 BPMs due to those rapid depolarization events. So there is no distinct P wave. Instead, we have this quivering motion. Now, this wave-like motion that indicates that the atria are quivering or fibrillating. So that's what can be noted in an EKG of atrial fibrillation. Secondly, we can note that when the signal reaches the AV node, there is that longer refractory period. And remember, when we talk about signal transduction, remember an action potential, a new one cannot be generated until the first one is completed. So since there is that longer refractory period, not all of the signals in the atria will reach the ventricles due to the AV node. So as a result, the ventricular rate, it will not increase as much as the atrial rate. The ventricular rate will increase to about 100 to 200 BPMs, whereas the atrial rate is 400 to 600 BPMs. So going back, we can see the irregular spacing, and we can see that there are no distinct P waves. Instead, we have like a wave-like motion indicating that the atria is contracting irregularly. And those are two distinct features of atrial fibrillation in an EKG. Now going back, so what is atrial fibrillation? It is the most common arrhythmia. It is essentially when the atria are quivering or they are fibrillating due to irregular, rapid signals that are coming from cells in the myocardium, which are canceling out that signal that are coming from the SA node, causing the atria to contract in an irregular manner. And when they reach the AV node, after that brief delay, it causes the ventricles to also contract in an irregular manner. Now, causes of atrial fibrillation range. It can be due to various types of heart diseases, obesity, genetics can play a role, alcohol and drugs, and varying other causes. Also, as we age, our risk of atrial AFib also increases. But that is essentially atrial fibrillation. Remember that it can result from two different reasons. It could be due to the formation of reentry circuits, or also due to ectopic foci, which are excitable pacemaker cells found in the myocardium. Now, one of the main concerns about atrial fibrillation is the potential form of clot formation, especially in the left atrium. And once that clot forms, there is the risk of the clot reaching the brain and causing a stroke, which can be very detrimental. But that is essentially AFib.